It's on? Okay. Testing, testing.
What are you doing? Talk about stuff tomorrow night? That's around
You
you.
go here, you go, you're verbally assaulted.
Yes.
Or we did, on the air.
Yeah, that was good.
On the air.
Wait, yesterday?
Dude, just step right in front of the camera, push words out of the way.
What? This is
Started yelling about Fauci and,
this morning?
yeah, not more than an hour ago.
And you didn't step out to be on the camera? to take
I
the
did
report?
step out, yes, I did.
He wouldn't touch my report.
He never touched, he's kinda, I saw him coming and I'm just like, I'm just gonna walk out here, pick back to John and Randy and, he swung his bat around. What's
I
that?
went that one time.
Good morning. Another week, more COVID cases and more COVID hospitalizations. The rapid spread of the Omicron variant has upended school plans, forced businesses to temporarily close or reduce hours, and their hospitals to ramp up messaging about getting vaccinated as they treat a record number of COVID patients. St. Louis County government also has its challenges, with COVID cases confirmed in all aspects of service. That includes our Department of Revenue, where more than a quarter of the 80 employees have either been out with a virus or quarantined because of exposure. Since the beginning of the pandemic, we've been able to keep county government running, providing more online options, and here in Clayton, bringing all services to the street level to reduce traffic on the elevators and on other floors in the building. Beginning tomorrow, we're going to make temporary changes in how the Department of Revenue delivers services to protect both customers and employees. It's the Revenue Department that interacts the most with customers inside our 3 county buildings: Clayton, Northwest Plaza, and Keller Plaza in South County. Here in Clayton, residents seeking in-person services will be required to make an appointment. If a resident comes to Clayton and does not have an appointment, they'll be encouraged to make an appointment at one of the kiosks just inside the entrance, or visit Northwest Crossings, which will allow walk-ins. Customers will receive a pager when they arrive at Northwest Crossings, serving as a walk-in only facility due to the larger space available. There will be limited seating inside, and if that's not available upon arrival, customers will be asked to wait in their car until they're notified by pager that they're next in line. If a customer walks into Northwest Crossing and decides the wait is too long, or an appointment can be made at one of the other 2 locations by kiosk at the entrance to Northwest Crossings. At the South County location, walk-ins and appointments will both be available. You can make an appointment through the county's website as well at stlewiscountymo.gov. That's stlewiscountymo.gov. A button on the front page will take you to the appointment page. For those who don't have access to the internet, you can make an appointment by calling 314-615-5500 or simply 311. But please go through the website if you can. This will be quicker for you and easier for our staff. We'll continue these changes in the Revenue Department until at least March 7th. The changes will be highlighted on the county's website, through social media, and through a press release later today. Hopefully, the press will help us get out the word as well. We're going to continue looking at how we deliver service across the county and how we're able to do it as safely as possible. Also under consideration is moving the county council meetings back to virtual. The council early in the pandemic moved to online meetings, and the technology is in place to immediately do so again. Gathering people in a room for hours at this time is not the best way to combat these growing numbers. Virtual meetings are another way to safely do county business as hospitalizations continue to climb. We're in uncharted territory. The healthcare systems tell us that it's going to get worse before it gets better. The number of COVID tests coming back positive now is nearly 40%, and our healthcare experts anticipate the spread is even greater than that because not everyone who's symptomatic is getting tested. I announced Monday that the Department of Public Health is increasing its testing capacity, and across the country, testing sites are opening up to meet the demand. These tests let people know their status and whether or not they need to stay home, isolate, and do everything they can to avoid spreading the virus. Meanwhile, please get vaccinated if you're not and get boosted if you're eligible. Thank you, and I'd be glad to answer any questions.
Dr. Page, doing the actions like limiting entrances to the Department of Revenue, things of that nature, what's the thought process there? Does that help control the spread in your mind, like what you're doing with the Department of Revenue, or what's important about those kinds of actions in your mind?
Well, the question is the importance of the changes that we're making in the Department of Revenue and why we're doing it. We do understand that COVID is spreading like wildfire in our community, and we need to do everything we can to protect our employees and patrons, and we want people to feel safe when they're coming in to get services from St. Louis County. One of the ways to keep them safe is to put some distance between them while they're waiting on the service. And making appointments, having people wait in their cars until their pager goes off to come in helps keep people from crowding while they're waiting for service from county government.
You say it's predicted it's going to get worse before it gets better. Do you foresee making these changes to other departments here soon?
Well, the question is about other departments and changes in the future. You know, the Department of Revenue is where we see the most public-facing services provided, people paying their bills and getting receipts and that sort of thing. But I would expect that all public-facing services will do everything we can to limit exposure to folks, limit people waiting in line. And all the services that folks receive downstairs in this building and in our other buildings are generally related to the Department of Revenue. But I expect we'll have similar procedures in place for any other service from county government to do everything we can to keep people from crowding or waiting in line.
Are you seeing any similar numbers of employees in other departments that are reporting being safe with COVID?
Well, the question is the number of people who are sick with COVID or have a positive test from COVID or are quarantined because of COVID, what that looks like. I think it's the same throughout county government. We don't have any indication that our folks that are on the front lines have more exposure to COVID or have more incidents of COVID because of their public-facing jobs. That's certainly they can pick it up anywhere. But regardless, we want them to be safe. We want them to feel safe. We want people who come to county government to receive services to feel safe. And the best way to do that is to limit the crowding in the waiting rooms. The risk of COVID exposure with the precautions we have in place from someone who's providing a county service is relatively small. What we want to do is avoid crowding in the waiting areas.
This is a virus, it's assumed it's going to be with us probably the rest of our lives. Is this going to go on forever?
So the question is about COVID and how long will it last? What will it look like? I think everyone in the country would like to know that. The science around COVID, changes weekly, sometimes daily. The right thing to do is to react to that science as it changes, to use the available resources to take care of as many people as possible, especially the ones that are at risk, to have the poorest outcomes if they're exposed to COVID or they're positive. We don't know how long this is going to last. We know that the next couple of weeks is going to be really tough in our community, and the next couple of weeks is going to be really tough in our country. And we're all going to work together to get through it. and we will get through it. We've had a lot of challenges in our country over the past 100 years, over the past 200 years, and we'll find a path through this. That doesn't mean that we should be reckless today. We should be doing everything we can on a personal level to limit the spread of COVID in our community. And if we do that, if we work together, then we'll get to the other side of this. There's going to be a lot of people sick. Unfortunately, there will be people in the hospital who haven't gotten there yet. The hospitals will be crowded and will have difficulty providing normal services to people who are in motor vehicle accidents or sick with strokes or heart attacks. They're going to be very busy and very stretched and very stressed. So we all need to do everything we can to limit the spread of COVID in the community, and we need to get vaccinated, and we need to get boosted if we're eligible.
What kind of policies does the county have for sick leave in these kind of cases for employees? How long do they have to quarantine for? Do they receive sick pay while they're out?
So the question is about county policies for sick pay. We follow the same quarantine guidelines as everyone else. If you're most county employees who can work from home while they're quarantined, or even while they're COVID positive, will do so. So a lot of our county employees will continue to do what they do. They just won't do it in their office. If you have a public-facing job, if there's no way you can provide the service that you provide, or there's no way you can provide a service for the county or be assigned to another task, then you're out sick. And that's part of the sick leave policy. I don't think that's that common. I think most people who work for the county can provide their service or something productive for the county virtually until they're recovered from COVID or until they're off quarantine.
Do you have any updates for us on the mask mandate? We know that the Attorney General said he's going to file a lawsuit. Any news there?
Question about the mask mandate and the Attorney General's lawsuit. I think the Attorney General is going to be busy filing lawsuits all over the state if he wants to get between local governments that are trying to protect their citizens with something very simple like a mask mandate. Lawsuits been filed. It'll move through the judicial process as they have in the past, but all that litigation that's proceeded in St. Louis County Circuit Court and federal court has eventually been resolved in favor of St. Louis County's position. The one lawsuit that did not go the way St. Louis County would like for it to have gone was a case in Cole County, which we weren't a party to, but we were affected by. And we've now appealed that case along with several other counties across the state, including some rural counties. And that's headed to the state Supreme Court. But I don't have a timeline for you about the Attorney General's litigation against St. Louis County. You'd have to ask his office about what he plans to do with all the other jurisdictions across the country, all the other schools that are trying to keep their folks safe with the mask mandate, and what he's going to do to try and stop that.
Opponents of the mask order are arguing that because there are no civil or criminal penalties for it, that it quote-unquote can't be enforced. I mean, we saw people in the council chambers last night not wearing a mask despite the order. How do you respond to that argument? And this question about enforceability?
So the question is about enforceability of the mask mandate. You know, there are some folks that just want to fuss about it. And you know, I don't know what to say to that. It's the same here as it is all over the country. You know, opposition to public health orders, opposition to masks, opposition to vaccines. We're just not interested in that conflict. I know folks are working very hard to initiate it, and we're just not biting. We know that most people in St. Louis County, when instructed that there is a mask mandate and that they need to wear a mask to keep themselves safe, to keep their family members safe, to keep the patrons to their businesses safe, then they do it. Most people do that. And we've seen a much higher mask usage over the past week in St. Louis County, that we have a mask mandate in place. We're glad to see that because we know it helps. I mean, this is a tragic and very serious problem that's sweeping our country, it's sweeping our community, and we all need to be doing everything we can to slow the spread of this virus. And the folks that don't want to do something simple like put on a mask, I don't know what to say.